Hi there, my name is Madison and I'm one of the nurses here at Dr. Winslow's office. Today I'm going to talk to you about preoperative instructions and some things to expect leading up to your surgery. So if you're having a facelift, a mini lift, a blepharoplasty, or a brow lift, you will want to tune into the instructions here. So we are going to cover what to expect the weeks leading up to surgery, how to prep and be best prepared for surgery, some supplies you may need, and considerations including like medication, as well as some really important things that first day post-operatively to keep you comfortable at home. As always, any specific instructions that were relayed to you directly from Dr. Winslow or the team that are patient specific, you should follow those. This is just a general video talking about the general recovery and what to expect for surgery, and may not be specifically planned just for your needs. If you did get any instructions that are specific to your medications or medical history, you should definitely follow those instead of this video. It is recommended that we never use nicotine. However, specifically 3 weeks prior to surgery, you should withhold any nicotine use. It can affect wound healing and recovery. We are able to do nicotine tests here in office if they are indicated day of surgery. We do also recommend that after surgery during recovery, nicotine is withheld as well. It's very important to review the medications that you're currently taking and discuss these with one of our registered nurses during your preoperative assessment. Typically, any supplements, vitamins, or over-the-counter medications are recommended to be withheld at least 2 weeks prior to surgery. However, your specific needs and medications will be discussed with one of our registered nurses and ran by Dr. Winslow. There are certain medications that we ask that you continue. Some of those may be blood pressure medications, but again, any specific medications that you take, we would like to discuss those thoroughly. Please do not change your medication regimen without letting one of us know so that we can consult Dr. Winslow and see what is best and safe for you. If prior to surgery, one of your primary care providers or specialty care providers changes a medication, please let us know so that we can fill Dr. Winslow in. Prior to surgery, we do ask that you have all of your medications filled and at home. If you have any questions or problems with filling your medications, please reach out to us sooner rather than later so we can get this addressed and handled for you. There are a handful of supplies that we do recommend having on hand at home after surgery. One of those being 25 milligram Benadryl. We ask that you have this on hand if you need help sleeping. We want you to have fresh pineapple. Fresh is the best option. Pineapple's core has an enzyme called bromelain, which really helps with deep purple bruising and reducing that. Specifically, the core of the pineapple is going to be the most concentrated portion with the bromelain. So although it is a little weird to be eating the core of pineapple, that is actually the portion that we recommend you eat to help with the bruising. Fresh is the best option. Frozen and canned just do not have that concentrated bromelain. In addition, Aquaphor or Vaseline are going to be very important for your skin health and hydration, and we like to have the incisions moist, so a dab of that will go a long way. And lastly, we do recommend having non-adherent pads such as Telfa. That's kind of the name brand, but those pads are going to be non-adherent, meaning that they have this like slick covering or coating on them that resembles the inside of a Band-Aid. That's going to be the recommended covering or dressing that you should be using post-operatively. If you routinely color your hair, we do ask that you get all fixed up and have your hair colored prior to surgery, because we will not want you to dye or color your hair at least 6 weeks post-operatively. So that is something that you can prep ahead of time and get that appointment set up. The day before surgery, we do recommend that you have a nice meal and stay very hydrated. You will be asked to be NPO or no food or water after midnight the day before your surgery. Upon arrival for your surgery, we do ask that you wear something that is comfortable, a button-up top and loose-fitting pants. We do not want anything that goes over your head. If you develop any illness such as allergies, upper respiratory infection, a stomach bug, or have any changes to your medication, we do ask that you keep us in the loop and let us know so that we can fill Dr. Winslow in and make sure that we keep your safety at the forefront. We do ask that an able-bodied adult is able to stay with you and monitor you for the first 24 hours after surgery. On the day of surgery, we ask that you park near the handicap ramp in the parking lot. Upon arrival, you will come to the second floor and check in with the girls up front. You'll have your Valium with you. They will actually have you sign surgical consents and sedation or anesthesia consents. Once you've reviewed those forms, you will take your Valium with a sip of water. You and your ride will actually sit in our relaxation room for roughly 30 to 45 minutes for that medication to sink in. Once a registered nurse borrows you, we do ask that your ride stay for an additional 10 minutes or so, just to make sure that we get you comfortable in the operating room and get a functional IV placed. They are allowed to leave during the duration of the surgery. We do just ask that they're within like a 20 to 30 minute radius of the office. When surgery is complete, they can promptly arrive to pick you up so we can go over discharge instructions. For the first 24 hours, it is generally recommended to stay ahead of your pain control and take the pain medication that's prescribed like it's scheduled. In the event that the pain medication that's prescribed is not really doing the trick for you, you are able to increase that medication to 2 pills as needed for pain. In addition, if that medication after being increased is not helping, please give us a call so that we can make sure that we're managing your pain appropriately and able to communicate that to Dr. Winslow. In regards to the steroid and antibiotic medications that we have sent over, you will start those the first day after surgery. The steroid specifically will say that you should space the medication out over 3 doses throughout the day. It's generally recommended that you space these out 2 times a day. So it may say the first day after surgery to take 5 pills. So you could take 3 in the morning and then 2 closer to lunchtime. When you take them closer to bedtime, it can actually keep you awake at night and cause restlessness. So we try to avoid that by having you take your last dose around the afternoon, lunchtime hours. One of the most important things after surgery is caring for your incisions. Some patients that have full facelifts may leave with a drain. It is recommended that you send pictures of the drain and the measure of output to Dr. Winslow, and we'll provide you with that phone number. Other patients, you may have dressings or sutures. We ask you to not touch any dressings or incisions unless directed by Dr. Winslow or one of the registered nurses. The day after surgery, Dr. Winslow will remove your dressing that surrounds your face if you have a mini lift or facelift. And after that, you can take a shower at home with lukewarm water, nothing hot, and utilize baby shampoo for cleansing. After surgery, we ask that you sleep on your back with your head elevated. We do not want you sleeping on either side of your head. This can cause an increased swelling and bruising to one side and distort your healing. In addition, sleeping in a recliner or with extra pillows behind your head can help you achieve that comfort when sleeping on your back. Icing can be beneficial after surgery. However, we do ask that you do not directly apply any ice to your bare skin. If you are wanting to ice, we do ask that you have a non-adherent pad in between your skin and the surface of the ice just to protect you. During your initial recovery period, we do ask that you take it easy and listen to your body. That first day after surgery specifically, we ask that you just rest and stay comfortable and focus on pain management. You should not be lifting more than 5 pounds. That does include purses, ladies, or doing any strenuous activity, including sex. We offer 5 complimentary hyperbaric oxygen therapy sessions for those patients that are getting full facelifts or mini facelifts. This can be very beneficial for the healing process in helping and reducing swelling and bruising. If that's something that you're interested in having, please let us know so we can get you scheduled for those appointments. Swelling, bruising, and tightness can all be normal for the healing process, but you know your body best. Everyone's healing is very different and unique to themselves. If something doesn't feel right, please feel free to reach out to us so we can keep Dr. Winslow in the loop and make sure that you are safe in your recovery. We ask that if you have any questions or concerns to please reach out and let us know so that we can talk with Dr. Winslow. Google is not the one that did your surgical procedure and doesn't know the ins and outs. Please do not listen to everything that you see online. We are here to support you throughout your recovery. If you need anything at all, please give us a call, send us a text message or an email, and we'll be happy to give you a prompt response. Thank you so much for choosing us for your procedure, and we can't wait to see you the day of your surgery.